Hi, I'm Dr. Andy Blauvelt. I'm a dermatologist and president of Oregon Medical Research Center in Portland, Oregon. I've been working with Ixekizumab in clinical trials since 2011. I have a lot of experience with this drug in both the clinical trial and in clinical practice settings. Today, I want to discuss the 24-week results from IXORA-R, a study that directly compared Ixekizumab and guselkumab in treating psoriasis. What's important about these two drugs are their molecular targets, which are part of the IL-23 Th17 immunologic pathway. IL-17A is produced from IL-23 dependent and IL-23 independent sources. Both IL-17A and IL-23 play significant roles in psoriasis pathogenesis. IXORA-R was the first head-to-head trial that directly assessed PASI 100, or complete clearance, at week 12 as its primary endpoint. The 24-week duration focused on the comparison of the early and peak responses for both drugs. The study met its primary endpoint at week 12, with Ixekizumab demonstrating superiority versus guselkumab in the proportion of patients achieving PASI 100. We saw Ixekizumab having greater rapid onset of efficacy with statistical significance compared to guselkumab at very early time points, weeks 1 and 2. The final gated secondary endpoint was superiority of PASI 100 at week 24. But Ixekizumab was non-inferior to guselkumab in a non-gated, non-type 1 error-controlled test. In regarding nail disease, an important feature of patients with psoriasis, we saw that there was a greater proportion of patients with statistical significance who achieved clearance of nail psoriasis with Ixekizumab compared to guselkumab at week 24. In addition, patients on Ixekizumab had a greater cumulative benefit versus guselkumab, with more days at PASI 90 and PASI 100, more days when psoriasis did not impact their quality of life, and more itch-free days. Regarding safety, both Ixekizumab and guselkumab demonstrated safety consistent with their known safety profiles, with no new safety signals observed during the 24 weeks. The frequency of treatment-emergent adverse events, including upper respiratory tract infections, nasopharyngitis, and injection site reactions, as well as the severity of treatment-emergent adverse events and serious adverse events, were similar to previous clinical trials and the known safety profile for Ixekizumab. Although there was one patient receiving Ixekizumab who had a treatment-emergent adverse event of Crohn's disease, this patient had a history of inflammatory bowel disease. Patients on Ixekizumab should be monitored for new onset or exacerbation of IBD. So what do these results mean to clinicians? Well, Ixekizumab's superiority in rapid efficacy has been seen against 4 other biologics now in direct head-to-head trials. Ixekizumab has also previously demonstrated sustained complete clearance over 5 years based on clinical trial data from 3 other studies. Indirect comparisons show it has one of the highest response rates for long-term complete clearance. In order to be clinically meaningful to patients, complete skin clearance should also be accompanied by an absence of residual skin signs and symptoms. This includes nail psoriasis, which is challenging to treat and can have a clinically significant impact on quality of life and functionality. In summary, the IXORA-R results showed that Ixekizumab was statistically superior to guselkumab in providing rapid efficacy and in achieving complete clearance through week 12, and was non-inferior to guselkumab in complete clearance at week 24. Ixekizumab was also superior to guselkumab for clearing nail psoriasis after 24 weeks. Thank you for your attention and have a great day.